Thank you for watching the Medical Class 901 with Dr. Shi. Dr. Shi MD is a renowned infectious disease specialist in the Memphis community. Without further ado, let's join the Medical Class with Dr. Shi MD.
My name is Dr. Chinelo, Animalu, and I am an infectious disease specialist out of Methodist University Hospital and a professor of medicine, Division of Infectious Diseases at UT College of Medicine. As you know, I take care of HIV patients. I'm a HIV specialist, and I love what I do. And so I do take care of our HIV positive patients in the hospital setting. And a lot of times what I've noticed, and when I sit down and talk with these patients, is the stigma that is associated with this infection, especially in the Black communities. People see it as such a horrible thing or such a bad thing, because I've had patients who did not want their family members to know, and then we have to make sure that they are safe, like their families do not know. But so one thing I would like to let people know is that there's no shame in it. There's so much bad stigma associated with this, and people would rather die than let the public know, or perhaps let their families know. So I want to use this media and let them know that it's okay. There's treatment out there.
Yes.
It wasn't like in the 80s, perhaps, when you talked about a family member that passed away. It was considered something of shame, like bringing shame to the family.
Yes, he was hiding it from us, and by the time he realized that, there was no judgment coming from us, he was almost in
AIDS.
He was really bad.
AIDS, which is acquired immunodeficiency syndrome, is the end part of the HIV infection. So it basically comes in like 3 stages: the acute infection, which is just a few weeks after you acquire the infection. Then you have a chronic cause, which will run for years. And then AIDS is the very last part. Mind you that how this infection works is by attacking your body immune system. So what happens is that when it eats up your body immune system, those cells in our body that helps us fight infection, those tiny infections that me and you can ward off becomes a problem. And so that's usually what will kill in HIV. So yes, we see AIDS on a regular basis. Once you're taking your medications, you're on the right medications, you will not progress to AIDS. It just becomes like a chronic infection. So what we see in the hospital will be somebody that perhaps did not even know they had HIV or was not taking their medications for whatever reason, and then they come in with one of these, we call it opportunistic infections. My name is Dr. Chinelo, Animalu, and I am an infectious disease specialist out of Methodist University Hospital and a professor of medicine, Division of Infectious Diseases at UT College of Medicine.